सर्व साधुने वंदन करता,
नमो लोये सब साहूणम,
सम्यक दर्शन मुझने मळजो,
देसो पंचन मुक्तारो,
सम्यक ज्ञान मुझने मळजो,
सौवा पाव पडासनो,
सम्यक चारित्र मुझने मळजो,
मंगलानं च सर्वेषु,
नवपदनी आराधना करता,
परमं अभय मंगलम, परमं अभय मंगलम, परमं अभय मंगलम।
अक्षत पूजा अक्षत पद आपे,
ओम नमो हरिहंताणम,
नैवेद्य पूजा हारी बनावे,
ओम नमो सिद्धाणम,
पारण पूजा शिव फळ आपे,
ओम नमो आयर्याणम,
भाव पूजा भव पार करावे,
ओम नमो वज्रायाणम,
भक्ति करता सब कोई बोले,
नमो लोये सब साहूणम,
घंटनाद करता करता,
देसो पंचन मुक्तारो,
चामर नृत्य करता करता,
सौवा पाव पडासनो,
दर्पण मूरत मनोहारी,
मंगलानं च सर्वेषु,
नृत्य करता भक्तो बोले,
परमं अभय मंगलम, परमं अभय मंगलम, परमं अभय मंगलम।
हरिहंत प्रभुना दर्शन करता,
ओम नमो हरिहंताणम,
सिद्ध प्रभुना दर्शन करता,
ओम नमो सिद्धाणम,
आचार्यों ने वंदन करता,
ओम नमो आयर्याणम,
उपाध्याय ने वंदन करता,
ओम नमो वज्रायाणम,
सर्व साधु ने वंदन करता,
नमो लोये सब साहूणम,
सम्यक दर्शन मुझने मळजो,
देसो पंचन मुक्तारो,
सम्यक ज्ञान मुझने मळजो,
सौवा पाव पडासनो,
सम्यक
Jai Jinendra, everyone, and Pranam. On behalf of the Oshwal Association of the UK and the Jain Health Initiative, thank you for joining us today. My name is Rajvi Punathar. By profession, I'm a cancer research scientist, and I'm also a trustee and executive committee member of the Oshwal Association of the UK. On the EC, I chair the education portfolio and co-chair the health and well-being portfolio with my colleague Poonam Shah, who unfortunately is unable to join us today. Today's webinar is the first in a collaboration between OA UK and the Jain Health Initiative. We have common aims, which are to educate and improve the health and well-being of our community and to drive change by challenging taboos and dispelling myths. So I'm very pleased to say we have with us here today Nemish Mehta, who is Vice Chair of the Jain Health Initiative and also Chair of GITO UK, and who has been involved in community work for at least the last 35 years. Nemish, welcome. Nemish, if you can put your camera on, that will be great, and then we can find you by spotlight.
Hi, thank you very much, Rajvi. So my name is Nemish Mehta, and I'm delighted to say a few words about the JHI. First of all, many, many thanks to Oshwal Association of the UK and Rajvi Ben for creating and presenting this seminar or webinar on menopause. And JHI is delighted to be supporting it and distributing it to the wider Jain community as well. So the Jain Health Initiative started in 2020 when we had COVID. Rajvi Ben and Ajay Bhai and a few other members of the different communities were founder members. And we reached out to a lot of our community and we made a big difference to the way people understood the vaccination process. After that, we went into a lot of other webinars, different health matters, and we've had a very good attendance. One of the aims we had was to educate people and help people with community requests. So in this case, Oshwal Association of the UK has put together this webinar on the menopause with some wonderful speakers, and they've also generously agreed to share it through the Jain Health Initiative for all the Jain members associated with One Jain. And I request all of you that if you have any requests about particular matters in medicine or health, and you would like help or you would like the rich medical talent within the Jain community to support you in explaining it, please reach out to us and we'd be more than happy to help. One of the activities that JHI is doing at the moment is to try and understand how people feel about the service they get from GPs. How easy is it to access your GP? How well supported do you feel? How proactive is your GP? And some of you may remember that we were asking these questions at the Swami Vatsalya earlier in the summer as well. So JHI exists to try and improve the well-being of all Jains in our community in the UK. And I look forward to further such collaborations. And in particular, I'm really very, very delighted that Oshwal Association of the UK has put this together and allowed it to reach out to a much wider audience. So Rajvi Ben, thank you very much for that, and back to you.
Thank you so much, Nemish Bhai. So let's go to the topic at hand, the menopause. Women today are living longer, are healthier, are more educated, and more present in professional and senior workplace roles than ever before. And yet we still multitask and manage households, children, and families. But every woman goes through a life-altering phase called the menopause, when her body changes dramatically, losing the ability to bear children. The symptoms can be debilitating and affect everyday activities. And without appropriate care, there can be severe physical, emotional, and mental impacts on health, personal relationships, and workplace participation. So it's essential that we as women are proactive in managing the menopause, and that we as well as women discuss this topic more openly and knowledgeably. And so therefore, I'm really excited to introduce our fantastic lineup of speakers who are going to give us the knowledge and the tools to do this today. So as I announce them, hopefully they will pop up on the screen so you can see their faces. So first of all, we have Reshma Datta. Reshma is a pharmacist by background, working within the pharmaceutical industry in a commercial function. Her special areas of interest are women's health, menopause, and Alzheimer's disease. She is happiest when in service to others and aims to do this while maintaining a balance between her family and looking after her health. Reshma will be sharing her own journey of managing her menopause and its impact on her family. Next, we will have Dr. Komal Shah. Komal is a member of the Oshwal South Area Committee based in Croydon, and she leads the youth and health and well-being portfolios. And when not volunteering for her community, Komal is a GP working in South London. She has an interest in women's health and has completed a diploma in obstetrics and gynecology. And Komal will be talking about the signs and symptoms of menopause. Then we will move on to Dr. Anuja Shah. Anuja is a GP partner with 25 years of experience and lives in London, although her practice is based in Luton. Anuja has many, many years as a GP trainer and a GP educator and an ex-primary care network lead. She has a special interest in women's health and the menopause and is very passionate about health promotion and prevention. And then lastly, we have Sushma Shetna. As well as being a chartered physiotherapist working in both the NHS and private sectors, Sushma is a qualified Ayurveda practitioner and having gained clinical experience in hospitals in Karnataka, South India. Sushma treats a wide range of pelvic health problems from pregnancy-related pelvic pain to male and female incontinence, infertility, and of course, menopause. So after all of these 4 presentations, we will have a question and answer session. Some of you have already started submitting your questions, which you can do on the chat function on Zoom. If you're watching on YouTube, please put it in the comments. We also will provide a link where if you wish to provide your questions anonymously, you can do so as well. So without any further ado, I would like to hand over to Reshma Datta, who's going to tell us about her own journey of managing her menopause. Thank you, Reshma.
Namaste, everyone. Jai Janendra, thank you for having me to speak to you here today. I'm just going to take a moment to present my slides. So my name's Reshma Datta. I'm a commercial healthcare pharmacist, and I'll be taking you through my menopause journey today. So my menopause started when I was aged 38, and it lasted quite a long time. I got it treated at 48, and some may wonder why I suffered with it for as long as I did. Well, for a long time, I thought it was hereditary, and the pattern should be similar to my mum's. And whilst my mum suffered a lot through her menopause, it wasn't for it quite as long at all. And therefore, I thought mine would take its own course and subside in a short period of time. It didn't quite work out like that. I also felt that this is just a part of life, and I felt like I needed to toughen up, just get through it, go on the other side and let nature do its talk.
Apologies, Reshma, we can't see your slides yet.
Oh, I'm so sorry. Okay. I'm not sure why. Can you see them now?
Yeah, if you can just go and present to view.
Yeah. Okay.
Thank you.
So I felt as though it was just a part of life and I needed to toughen up, let nature take its course and get onto the other side. So how was it for me? So bearing in mind, my husband and I are both the same age. This was his scene. He had a beautiful, peaceful night's sleep, no matter what time of the month it was. Next to him, this was me. My main symptom was night sweats. I had a remote control fan, and every night I went to bed armed with that, as well as a few changes of clothes next to my bedside, allowing me to change swiftly when I woke up completely drenched. The frequency of night sweats built up over time. So initially, it was just 1 or 2 days in the month, and then gradually it increased to, at the end, it was 4 or 5 times every night. This gradual build-up also had its impact in the sense that it somehow felt manageable for a long time because it was gradual, it crept up on me. The impact of this built up over time. Often in the mornings, I would wake up with a huge list of things to do. And I would feel like if I can just get through a few of these today, I would feel awesome. I would feel like I've, had a day that the type of day that I should be having. I felt overwhelmed by all the things that didn't get done. I felt frazzled. I felt just completely taken over by all the things that I wasn't getting through. And I also felt as though I wasn't participating in my family life like I should be. I wasn't picking up as much as I should be. Menopause has a funny way of coming up at a time in our lives when there are many other things changing, such as our children are teenagers, our parents are elderly, we may have career aspirations we're pursuing, as well as health goals. At this time, it really helped me to communicate with my family, to let them know what I was going through, what I was doing about it. Even though they couldn't help, the communication meant that they knew when I was exhausted or stressed by the minor things that I may not have done or the major things I may not have been able to do, they understood why. I focused on my well-being. I continued with a balanced diet and a variety of exercises, from HIIT classes to yoga. I had a regular bedtime routine, and I even took mindfulness classes. Whilst these things didn't change the root cause of why I was having these night sweats and why they were growing, it did really help me to cope with it all better. So despite doing everything I knew of to hold on to my health, to hold on to my youth, to preserve life, I felt like life was just so hard. Lack of sleep was truly soul destroying, and I just felt helpless. It got to a point when the last 2 months, the night sweats increased so much. I would wake up 4 or 5 times a night, every night. The fan would go on and off. I would still wake up drenched, change into a new shirt to help me go back to sleep. And although I would fall back asleep fairly easily, it wasn't long until the cycle repeated in an hour or two. This left me far removed from who I was, the type of life I wanted to live. And it had a huge knock-on effect on so many aspects of my life and my family's life. I didn't have the energy to fulfill my commitments, but my perspective also changed. So many things just felt like too much effort. I was exhausted all the time. I had brain fog, which meant that I just couldn't think clearly, and making simple decisions just felt so onerous. I was run down. I was getting minor illnesses, such as colds, coughs, frequent ear infections, and it had a huge impact on my life. I had lost my zest for life, just my bounce, my spirit. I couldn't find it anymore. My family also felt helpless because they could see that I was suffering. They could see what I was going through every night, but didn't know what they could do about it. It was high time to get some expert help. And in December 2020, I gave in. I made a phone call to get an appointment with my GP. And this lovely doctor seemed to come bounding out to my rescue. After listening to my journey, she said one sentence to me, which will stay with me for a long time. She said, "You don't have to suffer like this." She had clearly had this conversation many times before with lots of other women. So what was the magic? What could she do? What could she give me? She said to me, "There are many options available." And immediately I thought, but wait, I'm Indian. That makes me predisposed to heart disease. And in fact, I have a personal history of heart disease in my family. I can't possibly take any hormonal supplements or medicines to help me with this. And the doctor said to me, "Look at the data." And I was truly astonished when I looked at the data because it was surprising. And one of the other speakers, Anuja, will be giving you some very interesting insights into this later on in her talk. So I looked at this data. I did my research using many different resources, including an app from work called Peppy. I spoke to my family and friends. I had consultations with menopause specialist nurses who were also provided from Peppy. They gave me very holistic and comprehensive view on what my options were, what I needed to consider, and how to best make a decision. I attended webinars to learn more about the treatment options and different perspectives from different people on it. I listened to other women's experiences. I analysed the risks versus the benefits of the options I had. And I asked myself one key question: how long did I want to live like this? And as soon as I thought about that, I knew I didn't want to live like this anymore. I wanted my life back. I wanted me back, and I wanted my family to have me back. I opted to have transdermal medicines, which are gels and patches, so they're not taken orally. These have a greatly reduced risk of heart disease, so I felt more comfortable with those given my history. And Anuja will be giving you much more detail about this later on in her talk as well. So having been armed with all the information from the Peppy nurses, I started my patches and my gel, and within a few weeks of treatment, the night sweats reduced and then eventually stopped. Sleep returned. And with it, my energy returned. I was happier, healthier, not getting those minor illnesses anymore as much as I was. I was able to spend time doing things I wanted to do, such as spending time with family and friends, and also just being back to feeling like myself, not dreading having to go to sleep. And it was quite surprising as to how quickly the treatments worked. I took 3 key learnings from my journey. I realized I had an unconscious bias towards modern medicine. And despite being a pharmacist, I still had this and I didn't even realize I had it. And it needs to change. It needs to change because no matter what we think, we're not the center of the universe as women. There is a lot that relies on us, our kids, our parents, our partners, but there's a lot at risk if we don't take these treatments as well because of the suffering and the long-term effects of the menopause problems that it can cause. Second key learning I took away was that science advancements are here to help us. We should use them. That is the whole point of evolution after all. And thirdly, most important one for me was that menopause is manageable. There was no need to suffer for quite as long as I did. And as we get older, our bodies change and we need to make these little tweaks just to get through it and get to the other side to do all the things that we want to be doing. It is a different journey for everyone. Discuss your challenges, consider your options, and make informed choices. Most of all, take care of yourselves. That's what we need to remember to do. We take care of everybody else, but there are times when we also need to take care of ourselves. So you may be wondering, how can I do that? What are the options? What are the ways that I can do that? So the other speakers will be giving you a lot more information on this. But in terms of work, there's a lot of work being done in terms of menopause and the law. There are policies being changed, but even now under the Equality Act 2010 and under the Health and Safety at Work Act 74, there are provisions that can be made for working conditions when experiencing menopausal symptoms. ACAS has also introduced new codes of practice surrounding flexible working. So you may be wondering, how can employers help support us? They can develop a menopause policy, and many companies already have. They can provide training and guidance for managers to understand how to deal with it when their team are going through menopause. They can carry out health and safety checks to understand if your symptoms are related to something like this, and implement reasonable adjustments to make your working life more easier for you. They can also have champions, so people who have a lot more knowledge than the average person about menopause and well-being, and they can support the staff when going through these symptoms. They can also provide occupational health and mental health services where they're available. Some reasonable adjustments that you can ask your boss to make or your work to make for you are things like moving to a cooler part of the office, asking for a fan, asking for breaks when you need them, providing a space where you can rest and just manage your symptoms for a few minutes, requesting extra time off sick or sick days when you have menopausal symptoms, because it may only be happening a certain time in the month and you may need the extra support at that point. Being allowed to wear a different type of uniform if your experience means that you're having hot flashes and can't cope with the normal uniform. Providing you with flexible working, including working from home. So as you can see, there is lots and lots of information and support available out there. But I feel that we don't talk about this enough and we don't use it enough. So that's the end of my presentation. I'll be really happy to take any questions you have. Please pop them in the chat if you're on Zoom or in the comment section in the YouTube channel. And I'm going to hand over to my colleague, Komal.
Hi, everyone. Thank you for listening. Thank you, Rashma, as well. Jain. I'm just going to share my slides with you all. Hi, everyone. Thank you for waiting. So my name is Komal and I'm a GP working in South London. I'm interested in women's health, and in recent times, we've definitely noticed, due to social media input and recent celebrity TV shows, that women are now approaching their GPs, talking about the symptoms that they are affected by from their menopause. So today I'm going to be talking about what you need to know about the menopause. So let's start talking about the menopause. It's actually a natural biological process that is going to affect all of us women. Some of us may be watching aren't going to be affected until 10, 20 years time to come. There are many of us watching today who are possibly coming up to the menopause or have gone through the menopause already. It's important to know what the menopause is and what it actually means. So menopause is actually when you stop having your periods. And this is because the ovaries have stopped releasing eggs. And this is because your body's hormone called estrogen has basically fallen. If you approach healthcare professionals, often the diagnosis of the menopause is clinical. This basically means, according to your age and your symptoms, as long as you've had 12 months of no periods, this would be the point at which you have gone through the menopause. Typically in the UK, a lot of women will go through the menopause at around the age of 51 years. Really important to remember though, this can actually vary from woman to woman. And this could be any time from 45 years all the way to 55 years. And for some women, that may well be a lot earlier. And for others, that may also be a little bit later than 55 years. There are other reasons for why people may go through the menopause, particularly maybe much earlier, or not because of the natural process that their body dictates. For example, some women may have had their ovaries removed surgically, or they may have had to undergo certain treatments such as chemotherapy, or are having to take medications that induce the menopause for them. So let's just talk a little bit about the stages of the menopause. So as described earlier, menopause is actually at the point of where you've had 12 months of no period. Prior to this, women go through something called the perimenopause. This often starts at around the age of 45 years, and that period of time goes on until 12 months of no period. Essentially, about half of women, or more than half of women, when they go through the perimenopause, they will often be affected by the symptoms such as the emotional, physical, and mental symptoms that come with menopause and the fact that your estrogen levels are dropping. Once you have reached menopause, after those 12 months of no periods, you're now in the post-menopausal phase. Let's now go on to talk about the common symptoms. The slide currently shows a lot of the common symptoms that women may experience. Firstly, it's really important to note that whether you're in the perimenopause or postmenopause, the symptoms you experience may vary. The intensity and the frequency of these symptoms may well vary as well. And that means what you may have experienced in the perimenopause, you may not actually experience in the postmenopause, and vice versa. So let's just go through some of the common symptoms. Hot flushes and night sweats. So this is when you may get excessive sweating. You may feel a sudden rush of heat from the chest, neck, and face. And this can be quite debilitating. And as Reshma mentioned, that was one of the symptoms that she had experienced as well. You may experience brain fog, which can be like having like a fuzzy head, feeling like you're not able to concentrate or focus on tasks or things that you're doing, or even having memory issues. It can be accompanied by anxiety, stress, excessive worrying, or even low mood. You may also be affected by kind of urinary symptoms, or what we call vaginal and vulval symptoms. For example, itching, burning. When you pass urine, you may get vaginal soreness or dryness. You may also notice things like having to go to pass urine more often, or having to go very quickly to do so. And unfortunately for some women, actually it means that they may end up leaking urine. It can also cause women to have a low sex drive, i.e. low libido. And this is really important because this can actually affect intimate relationships with your partner or husbands. So it's quite important to have an open dialogue with your partners in regards to how your menopausal symptoms are affecting you. Some of the above symptoms, such as the hot flushes and night sweats, or kind of brain fog or worrying, etc., may actually affect your sleep as well. There are then other symptoms that are more general, such as joint pains, muscle aches, experiencing headaches, excessive tiredness and feeling like you're completely exhausted all the time, dry skin, hair thinning or even hair loss, but also dry eyes. And in particular, this might be also more noticeable in people who have contact lenses as well. A dental colleague has kindly given us information to present in regards to how menopause and its symptoms can affect your oral health. So one of these are things like jaw issues. So some people may actually find that the teeth become loose, or they may actually lose teeth. There might be gum-related problems such as bleeding gums, bad breath, painful gums as well. You can also get a dry mouth, which can then also affect the gum-related issues as well. Some women may experience sensations of like a burning tongue or a burning mouth, and this can then contribute to issues with eating, particularly if it's already quite painful because of experiencing these symptoms. It's really important, therefore, that you seek regular dental checkups. This particular dental colleague actually advised us that recent studies have shown that there is a link between poor oral health and brain function as well. For example, memory loss, Alzheimer's disease, and dementia. One of the frequent questions I often get asked by women when they come to see me and to talk about the menopause is, do they need a blood test to diagnose the menopause? The answer to this is no. And the reason being, this is a normal, natural process. Remember, as mentioned before, this is a clinical diagnosis. So according to your age and the symptoms, and if you're at that sort of right age range and you've got all the symptoms of menopause, your doctor or your healthcare professional will be able to tell you you are going through the change. However, this is actually a really good opportunity. So if you haven't been to your doctors for a while, or you haven't seen your practice nurse for a while, this is a good time to consider getting other blood tests done. For example, us being in the South Asian community, we are at risk of other diseases such as cardiac problems, type 2 diabetes, and problems with our bone health. So it's a good opportunity to get blood tests such as checking your thyroid function, because a lot of the symptoms of menopausal symptoms are often vague, checking your vitamin D levels, checking your iron levels, and also checking things like your cholesterol and a diabetes blood test. It's also really important to note that there are some women who will need to have a blood test in order to help diagnose the menopause in them. One particular group of women are those women who go through the menopause much earlier. Premature menopause. So this is actually when women who are under the age of 40 years old go through the menopause. These women will often present because of lack of periods. And if they get to the point where they've had 12 months of no periods, they will need to be investigated for this. Another name for this is known as premature ovarian insufficiency. Also important to note that obviously some women who are under the age of 40 may have had to have surgery to remove the ovaries, or may have had to have other treatment that has induced the menopause before the age of 40 years. Often for women, this is actually a very difficult diagnosis to have to accept. It has a huge emotional and psychological impact. And the reason being is, for some women, they may not have had the opportunity to have children and have gone through premature menopause. So this will affect their fertility and their chances of becoming mothers. These women in particular will have an increased risk of osteoporosis and also increased risk of heart-related problems and stroke in the future. Let's talk a little bit about postmenopausal issues. I'm not going to concentrate too much on the urinary symptoms, cardiac issues, or the bone-related issues. Today, I'm going to be talking to you about postmenopausal bleeding. So this is any bleeding from the vagina that occurs after you've gone through the menopause, so that 12-month period of no periods. The reason this is important is actually any bleeding after the menopause is what we call an urgent kind of worrying symptom. And this would normally instigate an urgent referral to rule out endometrial cancer. If you ever experience bleeding from the vagina after the menopause, it's really important that you seek professional help from your GP so that you can be referred appropriately. Take-home points from this is you do not need to suffer alone, just as what Reshma has already advised. Ask for help, whether that's through your GP, your workplace, and keep an open dialogue with your family, friends, colleagues. And remember, every woman's experience of their menopausal symptoms will be individual, but what may help you may help someone else. So share your knowledge and vice versa. Thank you so much for listening. I'm now going to hand over to Dr. Anuja Shah. Please send any of your questions in so that we can address later. Thank you.
Thank you, Komal. Thank you for giving that very informative talk on and explaining to us how almost each and every part of our body is affected by the menopause. And this is because there are estrogen receptors everywhere on our body, even our mouth. Today, I'm just going to share my screen. Namaste and Jai Shinendra, everyone. I'm Anuja Shah and I'm a GP with specialist interest in women's health. And today I'm going to talk about the management of menopause. Why do we need to manage the menopause? Surely our mothers and grandmothers didn't need any treatment. These days, women are attaining the menopause much earlier. The average age of menopause is now 51. It used to be 57. It's now much earlier. And we are living much longer. A woman might live with the menopause for around 30 years. A lot of women say that their lives have become joyless after the menopause and the color has been drained from their life. Moreover, women are now holding important jobs and they might be at the peak of their career at this time. They are also caring for elderly parents and teenage children or even grandchildren. And the symptoms of the menopause make it very difficult for them to continue in these roles. Many women retire early or start taking part-time jobs because they can't cope anymore. We don't need to suffer anymore. I'm going to start off with sleep because I think a good sleep is the building block for healthy life. And Reshma has very eloquently described the effects of the menopause on sleep. Lack of sleep can have a very negative effect on our brain function, making us feel tired and causing memory loss and brain fog. Research has shown that keeping your bedroom cool helps improve your sleep. The optimum temperature to keep your bedroom at is 18 degrees centigrade. Also, a consistent routine and regularity helps improve quality and quantity of sleep. Go to bed at the same time and wake up at the same time every morning. And yes, weekends as well. Avoid caffeine and alcohol, especially late in the evenings. Many women feel low, depressed, stressed, and anxious. It's very important to deal with this. Sleep, of course, we've mentioned, is extremely important. Eating well is also very important. Have plenty of fresh fruits and vegetables and keep your carbohydrates to up to a third of your meals. Have a Mediterranean style diet. Cut out smoking and alcohol and get out. Make time for regular exercise. Meditation improves stress by lowering the cortisol level, the stress hormone, and produces more of the happy hormones, the dopamine and the serotonin. 10 minutes of daily mindfulness helps, being aware of your surroundings, your breathing, slow down, breathe deeply. There are many apps to help with mindfulness and meditation. Meet up with friends. It's really important for your mental health. If you're still struggling, get help. See a professional. Talking therapy and counseling will help. I can't emphasize enough on the importance of regular exercise. It improves bone health. Bones get stronger as you use them and get them to work. Aim for weight-bearing exercise, which gives impact, such as running, jogging, walking, or climbing. It also helps maintain your muscle mass because you lose muscle as we get older. This will prevent falls and fracture in future. Regular exercise also helps maintain a healthy cholesterol and reduces your blood pressure, thus helping your heart. It also helps with your mood, as discussed earlier. It helps you to stay a healthy weight. And we know that falling levels of estrogen means that you can accumulate fat in the middle, which increases your risk of having type 2 diabetes, heart problems, and cancer. If, like Reshma, if you're still suffering from the perimenopausal symptoms, help is available. Speak to your GP, who will want to discuss HRT with you or hormone replacement therapy. You don't have to wait for your periods to end. You can go and see your GP while you're having these symptoms, and HRT can be started at any time. You don't have to wait until your periods end. It is the most effective way to treat your symptoms. It gives a steady flow of the hormone, which is now either fluctuating or declining in your body. Your risk of osteoporosis, heart problems, type 2 diabetes, dementia, and certain cancers can be reduced by taking HRT. HRT is most effective if started within 10 years of the menopause. Hormone treatment includes estrogen and progesterone. Some women will also require testosterone if they have persistent symptoms of tiredness, memory loss, lack of sexual desire in spite of having estrogen therapy. So let's talk a little bit about the different hormones. Estrogen. The type of estrogen which is now most commonly used is actually derived from the yam plant. It has the same molecular structure as the estrogen produced in your body. Hence, it's body identical. It is available in patch or as a plaster that you apply on your below your waist, or as a gel that you rub on your thighs or your tummy, or a spray that you spray on your arms, or tablets that you swallow. While tablets are okay to use, it slightly increases your risk of blood clots as it is digested and then metabolized in the liver. The liver also produces the clotting factor, and hence tablets can interfere with this. It is a very, very small risk of blood clots, but having the estrogen as a transdermal or as patches and gels is actually safer. It is also available as vaginal pessary, gel, and ring, which is used mainly for vaginal dryness, itching, and urinary problems. If you still have a womb, you have to take progesterone alongside the estrogen to protect the lining of your womb. Estrogen can cause the lining to thicken, and hence it can cause irregular bleeding, and very rarely it can cause cancer of the womb. Progesterone will thin the lining and protect the womb. It can be taken along with estrogen as a combined HRT in the form of tablet or patch, or it can be taken separate to the estrogen. The safest progesterone is called micronized progesterone or Utrogestan, as a brand name is in the UK. It is also derived from the yam plant, and it is available in tablet form. Many of you might have heard of the Marina coil. The Marina coil has got a progesterone in the stem of the coil, and then it is inserted vaginally, and it is used as part of HRT to protect the womb, and it's licensed for 5 years. The same coil can also be used as a contraception. So, it's an added benefit to have the Marina coil. We're all worried about the side effects and risks of HRT because the HRT has had really some over bad press. Let's talk about the side effects first. So sometimes you may have some side effects such as sickness, breast tenderness, leg cramps, but these tend to settle down in about 3 months or so. Some estrogen tablets carry a very small risk of blood clots, as I've explained earlier. It is safer to use the transdermal HRT, such as patch, gel, or spray, if you are at an increased risk of blood clots. The risk of breast cancer is the most worrying for women, and in my next slide, I'm going to explain that a little bit more. The risk is reduced by using the micronized progesterone, utrogestin. For majority of the women under the age of 60, benefits outweigh the risk. So this slide will help understand the risk of breast cancer with HRT. Now, if you look at the left-hand column, you will see that in a normal population, over a 5-year period, you expect to have 23 breast cancers for every 1,000 women. Now, if you look at the middle, you will see that there are 24 cases of breast cancer in women, additional cases of breast cancer in women who are overweight. And also 5 additional cases of breast cancer in women who drink in moderation every day. So 2 or more units of alcohol per day. In comparison, there are only 4 extra cases of breast cancer in women who are on combined estrogen and progesterone HRT, and 3 in smokers. So there is more risk of breast cancer if you're overweight than if you're on HRT. This puts it into some kind of perspective. So it's better to be of normal weight than to be overweight. Now, if you look at the right-hand side, you will see that there are 7 fewer cases of breast cancer in women who exercise regularly. All the more reason to exercise regularly. And 4 fewer breast cancers in women who are on estrogen-only HRT. Thus, you can reduce your risk of having breast cancer by exercising regularly if you are on the combined form of HRT. I wanted to touch upon the skin changes of the menopause because this is something that obviously women are, as women, we're very proud of our appearance, and we should be. As Komal has already described, your skin can get dry and itchy due to the loss of ceramide and oily secretion. Avoid soaps and shower gels, as this will further reduce your the oily protection, leaving your skin feeling very dry. Use soap substitutes instead and moisturizers. So soap substitutes can easily be bought over the counter. Some of them are Dermol 500, Zero Base, or even E45 or Aveeno, some of the few. Use moisturizers, and you don't have to buy expensive anti-aging creams. Ordinary moisturizers work just as well. Just like the bones, our skin is also affected by the loss of collagen, and the elasticity is reduced, leading to thinning and aging of bone. Many women do not want to come off their HRT due to the positive effect that it has on the skin. Using moisturizers will definitely help. As ultraviolet light from the sunlight also causes aging, it's a good idea to use sun protection when you're outdoors. Redness and rosacea, particularly around the center of the face, is quite common. Acne can reoccur. Your doctor can give you treatment for both these conditions if you are suffering from these. Hair loss is another common problem. Our crowning glory, and we find that particularly after washing your hair, we find that we're losing a lot of hair. Sometimes you also just notice that the parting on your hair is becoming wider. Eat nutritious food, avoid damage by using gentle shampoo. Make sure that you're having enough iron in your diet. Also, make sure that your thyroid levels are normal. Other treatment that are available. Cognitive behavioral therapy is useful for low moods. Antidepressants are sometimes prescribed for hot flushes for women who cannot take HRT. There is no evidence of the safety of herbal medicine that are available in the market. Speak to your healthcare professional, but ensure that the herbal preparations that you do take have the traditional herbal registration mark of certification. Sushma will tell us a little bit more about Ayurvedic treatment for management of menopause. So some take-home messages. There are more benefits to HRT if started early. Long-term hormone deficiency will increase your risk of having heart problems and osteoporosis. HRT does not delay your menopause. Risk of other diseases such as type 2 diabetes, bowel cancer, depression, dementia, osteoarthritis will reduce on HRT. There are some really useful resources such as the Balance app, which has really useful fact sheets and videos in different languages. Please tell your friends. The patient info and menopause matters also has some really useful information. Thank you for listening and thank you for your time. Please send your questions through Zoom chat or YouTube comment section. I'll now pass over to Shrishma, who will give you information about the role of Ayurveda in the management of menopause. Thank you.
Thank you very much, Anuja, for that very comprehensive management of Ayurveda, management of menopause through the conventional medicine approach. Let me share my screen. So, namaskar, everyone. Jai Janendra. My name is Sushma Shetna. I am an advanced physiotherapy practitioner. That is a practice that goes hand in hand with conventional medicine. I also am an Ayurveda clinician as well as an acupuncturist, which is the holistic medicine. So today we're going to look at now, after having had an amazing and very comprehensive conventional medical approach to tackling menopause and listening to a very engaging story from Reshma, how she managed her menopause successfully. We will look at how holistic medicine, particularly Ayurveda and acupuncture, can help to complement the therapies we have discussed already. Just to touch upon the conventional medical approach.
Sorry, your screen is not shared.
Oh, sorry. I can see my screen. Is that better? Or?
No, we can't see anything yet.
Sorry. Okay, sorry about this. Is
yeah,
that
that's working now.
Sorry about that. So the conventional medical approach is analytical approach, where we look at every organ, every aspect of the disease and the symptoms, and then the therapies and the management of that condition and the symptoms is advised. Holistic approach is looking at the individual, the being as a whole, and it is not purely just the physical, but their emotional, intellectual, spiritual being is also considered. So looking at conventional medical, we are even looking at the cellular level and how, the effect of symptoms can affect the cells, what medicine can be given to make those changes. Holistic medicine will look at the individual's entire aspect, emotional, spiritual, intellectual, as well as, of course, the physical. Looking at it from Ayurvedic perspective, Ayurveda looks at the individual as a continuum of the universe. Loka, Purusha, Samya, that Loka meaning the universe, Purusha meaning the individual, and the engaging of the two. So macrocosm to microcosm continuum. 5,000 years ago, our seer, Sushrita, has given the definition of Ayurveda, definition of health, as one who is established in self, who has balanced energies, which are the doshas, balanced metabolism, properly formed bodily tissues, which are the dhatus, and proper elimination of malas, the waste products, and one whose mind, soul, and senses are full of bliss is healthy. So the entire aspect of the being is considered. Menopause in Ayurveda. So according to the Ayurveda philosophy, the entire cosmos is an interplay of the energies of the 5 elements: ether, air, fire, water, and earth. Ayurveda groups these 5 basic elements into 5 functional principles known as Vata, Pitta, and Kapha. Then we have Ojas, which is refined Kapha. It is a superfine substance that is responsible for building our immunity, stability, and nourishment. So you can say that it is a very subtle form of Kapha and the very end product of nutrition in our body when it passes through all 7 dhatus or tissues, including the final layer, which is the reproductive organs. That is Ojas. Tejas is refined Pitta. That means it acts as a positive, subtle essence of Agni, our digestive fire. It governs our ability to discern, our intelligence, our enthusiasm, as well as digestion and transformation. Ayurveda believes that in the childhood, the Kapha dosha or the Kapha property, Kapha energy is predominant, which means it's a time for growth, building up, learning, and Ayurveda associates that with Kapha, the dosha of earth and water. As we grow from becoming from a child to an adult, entering from puberty to adulthood, Pitta dosh predominates, which is the time of achievements and accomplishments. It is associated with Pitta, fire, and water. And then there is elderhood, which is the time to take a step back, to contemplate, and maybe a period of letting go of the need to achieve. This is associated with Vata, the principle of ether and air. So Ayurveda looks at menopause as a stage in life, one of the many journeys of our life, as we enter from a childhood to puberty, then to adulthood, and then to having menopause and further on. It doesn't consider menopause as a disease as such. In menopause, as Komal and Anuja explained to us, we have depletion of our hormones, the estrogen and progesterone, which means that we are depleted in Ojas and Tejas, and the Vata is deranged. Now, the deranged Vata will bring on many symptoms that we discussed. Dry skin or mucous membranes, including vagina, so it can impact the sexual life. Bleeding will become scanty during perimenopausal period. We will have digestive discomfort, maybe constipation, trouble concentrating or sleeping, coupled with anxiety levels shooting high, worry and fear, and in extreme cases, bone loss, osteoporosis. This could be the consequences of deranged vata in our body. Similarly, pitta, the other dosha, the fire and the water element, derangement of pitta can give us hot flushes, make us irritable, and during perimenopausal, the bleeding can increase. It can also bring on skin issues, imbalances, and from an emotional side, it can bring anger, irritation, sentiment of jealousy, even criticism, competitiveness. You may have a lot of feeling of excess heat in the body, and in extreme case, heart imbalances. Disturbance or depletion of kapha can cause weight gain. Also, the feeling of sadness. Maybe you feel unmotivated, greedy for food, comfort food, and that may be the cause of you putting on weight. Also, your concentration will reduce due to feeling dull and feeling bogged down. So, how do we manage this menopause from Ayurvedic perspective? Building rasa, building juiciness in our body. Now, many of us would be aware that Abhyanga, which is the Ayurvedic massage with herb-infused oils, would help to balance kapha, to improve our skin, as well as to improve the sense of well-being. Couple that with rasayana herbs, rasayana meaning increasing rasa in the body, and there are many specific herbs in Ayurveda that can build the depleted kapha and depleted ojas in our body. To calm that vata, one need to make peace with our past. Eat vata balancing diet. So rather than dry, cold foods, always have warm, well-cooked food. Maybe use sesame or coconut oil. Spices such as fennel, cumin, coriander, saffron, turmeric, and asafoetida, all found in your kitchen, could be very useful in balancing your pitta. Do reduce caffeine and alcohol intake, and engage in good breathing techniques such as pranayama and yoga. To keep the Agni, the digestive fire, acting well in its seat, which is in the stomach, have ginger before and after meals. Also have fennel and coriander teas. Hot flushes, one of the symptoms of menopause that Reshma described. Treatments such as breathing techniques like Nadi Shodhana, which is the alternate nostril breathing. Maybe practice that for up to 20 minutes a day, just to balance, just to calm yourself and bring in the coolness. Shitali pranayama is a very specific pranayama that improves the kapha in our body, bringing the coolness. Try cooling foods such as pomegranate and fresh lime, peppermint tea. Sleep, another factor that is affected. Have a glass of warm milk, which is milk boiled with nutmeg powder and a pinch of turmeric. For vaginal dryness, local application of sesame oil or ghee or even aloe vera gel, very useful and very effective. For heart health, meditation, exercise, and maintaining healthy weight. Now, exercise is very important, particularly weight-bearing exercise. And the bone health can be looked at by making sure that we have healthy bowel movements, taking enough calcium in our diet, and daily dose of vitamin D, continuing with weight-bearing exercise. In addition to the typical cardiovascular exercise that we all do, yoga postures, which are weight bearing and which actually open up our hips and our pelvis, such as Warrior 1 and Warrior 2, Veer Bhadrasana, so that the seat, the pelvis is strengthened, the core is strengthened, and the root, the pelvis and the sacrum, which is the root of the bony tissue, is stimulated by such postures. Regular practice of this yoga would be highly beneficial, not just from a bone health perspective, but also from a balance and reflex mechanisms which are improved and that can reduce the risk of bone fractures. Herbs. Now, there are very specific herbs for management of menopause, and they should be prescribed after a detailed Ayurveda consultation rather than taking general advice and general looking at the internet and saying a particular herb may be useful for such and such symptoms, because Ayurveda believes in individual assessment, as every individual has got a unique body type, and for that body type you may want to have a specific herbal treatment. So Ayurveda can help in a comprehensive way, provided you have had a good consultation and a good understanding of what your body type is and what your constitution is like, and what kind of management would be more specific for yourself. Now, acupuncture, the traditional Chinese medical, it's one of the limbs of the traditional Chinese medical system. TCM also believes that the human body is a microcosm of the universal macrocosm, the same principle as in the other holistic therapies. Therefore, humans must follow the laws of the universe to achieve harmony and total health. So the yin-yang theory, balancing the female and the male energy, is the core of traditional Chinese medicine. And acupuncture believes that by stimulating certain points on the meridians, which are the channels on a body, where the flow of qi or the energy constantly goes, by stimulating certain points, we unblock or unobstruct those areas where there is a problem or a disharmony. And acupuncture believes in stimulating those points at certain superficial levels on our body. Mainstream medicine says that by stimulation of nervous system, of stimulation of certain points, there is release of chemicals in our muscles, the happy chemicals, as well as in the spinal cord and brain. There is a good body of evidence for acupuncture, which shows that there is a release in the muscles as well as in the nervous system of endorphins, the happy chemicals, which will relieve the pain, which will also relieve the symptoms of fatigue, tiredness, lethargy. And so acupuncture can be another excellent adjunct to assist in menopause. So here we have complementing the conventional medical approach, holistic therapies, which can come to a great help in not only just dealing with menopause and dealing with the symptoms, but making it a very positive journey of a life as we move forward. Thank you all very much for listening. Please put your questions in the chat box or in the YouTube comment box. And now I'd like you to head over to Rajvi, who will be tackling the next session of our questions and answers. Thank you.
Thank you very much, Shushma Ben, and in fact, thank you to all our presenters. They've put an amazing amount of work and preparation into their presentations. They are very busy, especially our GPs. We know how busy they are, and I really appreciate the time they've taken out to prepare their slides and to practice with us and to come on today. Also, a big shout out to our technical team, Kilit Shah, Ketan Shah, Ajay Punata, and Nemish Pai from the JHI for this great collaboration. We have a question and answer session now, and we've had so many questions come through, both on Zoom chat and on YouTube. So we'll be putting them to all our speakers just in a short while. Please do continue to post any questions that come to your mind, and we will try and put them to our panelists as long as we have time. Now, this webinar will be available for people to watch. So if you know anyone who wasn't able to view live, it will be available on the Oshwal YouTube channel, also on the One Jain YouTube channel. We also have got a list of all the links and apps and lots of useful information that we will be posting next to it on our website. So it's called a sources document. And in the new year, part of our collaboration, we have some new topics that we will be presenting to you. We're planning one on men's health. Why don't men go to the doctor when they should? And on mental health in youth and young people. So now we're going to start our Q&A. If I can have all of our panelists back on screen and unmuted, that would be great. And Rashma, if you're ready to ask the first question and see where we go with that.
Sure, thanks, Rajvi. So one of the questions we've had come in, which I'd like to direct to Komal, is how long does the perimenopause period typically last?
Hi. So when we talk about the perimenopause, actually that can last up to a few months to up to actually several years. So, you know, unfortunately for some women, they may actually experience the perimenopause stage for about maybe like 10 years. Like if they've started having symptoms, for example, at the age of 38, and actually they don't go into they don't stop their periods until they're like 48, for example. So it's really variable from woman to woman. So there's no definitive answer to that question, but essentially it can be quite variable.
Thank you so much, Komal. Sushma Ben, I have a question for you, and you may have answered it in your talk. Does Ayurveda Panchakarma therapy help in menopause?
Yes. So the Panchakarma therapy is when you do the medicated purgation, medicated virechan, which is and medicated emesis. Those are the parts of Panchakarma therapy. Also includes treatments like Abhyanga, the massages, even sometimes nasal medication. Now, those therapies could be very useful and very effective for menopause, provided, like I said previously, that there has been a consultation from an Ayurveda physician for the individual, understanding your body type and understanding what kind of therapy specifically is going to be beneficial. One thing I would say is that Ayurveda is a type of treatment where you require tremendous amount of, the first thing is, I use the word surrender, active surrender, meaning being open and receptive to the therapy that you're going for. And secondly, have perseverance and patience. So make sure that you have been assessed thoroughly, and then the treatment which has been advised by your physician, Ayurveda physician, you need to incorporate that into your lifestyle first, which takes time. So just to give a very briefly a simple analogy, when you want to decorate your home, you will be cleaning the walls first. You will be making sure that there are fillers and everything before you paint the wall. So exactly in that same way, once you have approached the Ayurveda treatment, you would be making sure that you cleanse your body first internally, and with the dietetic management you have been provided for, maybe use the appropriate herbs, and then use Panchakarma therapy, which is the painting on the wall. Okay, so it is useful when it is applied judiciously.
Thank you, Sushma Ben.
Great. Next question we have is, do women in the perimenopause need contraception? Can I please direct that to Komal?
Yes. So really important when you are going through the perimenopause, you have to remember your periods are may well be irregular, and therefore actually we would be encouraging women who are actively sexually active to actually make sure they're also using contraception. That's really important. Normally we would suggest, women to seek that advice from their GP. HRT is not a form of contraception, so it's important that you use another method to prevent pregnancy.
I just add that if your last period was before age 50, then you should take contraception for 2 years after your last period. If your last period was after age 50, then you should take contraception for 1 year.
Okay, great. Thank you so much. Anuja, a question for you. And also perhaps Shushma Ben, but we have to be brief about this. We've got loads of questions, so if I can limit you to really brief, concise answers. I was wondering if there is any information on which treatments are suitable for Jains and vegans. I'll take that to you, Anuja, first.
Yeah. So as I said, the patches and the gels, to my knowledge, they don't contain any gelatin or anything like that. I may be wrong. I'd have to double check. The Utrogestin capsule, I understand the capsule itself contains gelatin, but you can have the Marina coil and you can have other progestogens, but Utrogestin is safest. So I think if you're if your risk of breast cancer is high, then I would still suggest the Utrogestin capsule.
Okay.
I would just add that from Ayurvedic perspective, although we typically say Ayurveda is herbs, but Ayurveda actually does have the other options as well. So Ayurveda is very comprehensive. However, the herbs that could be used for menopause are obvious. They are absolutely fine for vegans as well as for Jain community. So herbs such as, say, for example, shatavari or ashwagandha they're just herbs from the plant origin.
Thank you.
Thank you. Anuja, I have an interesting question here for you. If you start taking HRT, is it for life?
You can. There is no upper age limit for HRT. So as long as the benefits outweigh the risk, you can take it for as long as you think that you're gaining benefits. Obviously, you have to have a review with your GP every year, and your GP will decide whether it's safe for you to carry on.
And just following on from that, I think for you, Anuja, as well, how do you know if you're in perimenopause or menopause when you are taking HRT? As for you and Komal, I think that one.
The reason you're probably taking HRT is because you're in perimenopause. If your periods have stopped for any reason, if you're taking progestogen for any reason, your periods have stopped, and if you want to know if you should carry on, say you should carry on contraception or whatever, then that is another reason where you can have a blood test to check your levels, and then you can decide whether you still need to carry on contraception or not. The fact that you're on HRT is because you're in the perimenopause.
Great.
Thank you.
Thank you. I have a question here, which I'm going to ask Anuja and Sushma Ben to answer. I am over 70, but I still get hot flashes. What can I do to help?
As described earlier, there are a few things that you can do to help with the hot flashes. CBT sometimes helps. Obviously, all the kind of lifestyle changes, wearing cotton clothes, having a fan if you're working, just making sure that you have good ventilation. Age is no barrier to HRT. So if all other, if you haven't got any other risk, you can still go on HRT for maybe a couple of years and then you can stop, so age is no barrier. As long as you haven't got any other, as long as the benefits are more than the risk, you can still have HRT.
Great.
Sorry.
Yeah, carry on.
Just briefly answer that from Ayurvedic perspective. So Ayurveda would look at a 70-year-old and why you're having hot flushes. Maybe something in the lifestyle or something is that is constantly bothering. So that aspect needs to be addressed. But as we said earlier, Shitali pranayama, Shitali breathing technique would be very beneficial to and completely harmless to try. But again, the underlying cause why that happens needs to be addressed by close questioning, which will come from an Ayurveda consultation.
I'll also add that if these are new onset of hot flushes, then you need to make sure that there's nothing else which is causing it. For example, any thyroid problems or anything else so you should speak to your GP.
Great, thank you. I have a couple of HRT questions. So I guess for you, Anuja, would taking HRT stage not in fact delay the menopause? I think a lot of people are confused by that. Why it wouldn't? And the second question is, at what point do you stop taking HRT to bring on the actual menopause stage? So if you can answer those questions.
Okay, so as Komal has described, menopause is actually when your ovaries are kind of stopping producing the hormones, So we're just in the form of HRT, we're just giving you the hormones from outside. We're not going to wake your ovaries up again to start producing hormones. So we're not delaying the menopause. The menopause obviously happened or happening. We're just helping the symptoms and we're protecting you. It doesn't mean that we are delaying the whatever natural processes in the body. So we're not delaying the menopause. And as I said earlier, you can carry on taking the menopause until the benefits outweigh the risks.
Thank you.
Thanks. I have a question that I would like to answer. What can help when you get hot flushes in the middle of the night and you will wake up with heat mad, need to cool down by switching on the fan or open a window? So I'm obviously an expert at this. First of all, you need a remote control for that fan with fresh batteries every week. Get your husband or someone else to make sure those are up to date. There really isn't anything that you can do. The only thing that I ever did was have the fan, have the window, but also have fresh clothing nearby so that I can just change. What I found helped me the most was not to spend too long being awake. So when I would wake up and I would be drenched, I would quickly go to the bathroom, change, I would get back into bed, and I would just switch off and just go back to sleep. And that did help me fall back asleep more easily. And by the morning, even though I was having broken night sleep, I had sleep and it felt better than lying awake, being frustrated and annoyed and thinking, why is this happening to me? I stopped asking questions. I just took it as, this is a part of what I'm going through. I accepted it. I dealt with it in the night. And then I had questions during the day. I'm sorry if that's not that helpful, but that really is all that you can do when you're suffering through this in the night.
Excellent. I have a question here for joint pain. So someone's asking, can you suggest something for joint pains and brain fog, or will it just pass, the brain fog in particular? So I guess a question for both Anuja and Sushma Ben here. Anuja first.
I think joint pains, again, many women find that it's a vicious circle, isn't it? You've got joint pain, you can't exercise, and then you can't exercise, so your joint pain gets worse. So in fact, some women find that once they start taking HRT, they can start exercising better. So it helps them in keeping fit and keeping in doing exercises. Obviously, physiotherapy and exercise will help. You can take painkillers to help you through the pain, so you're able to do the exercise and physiotherapy. And the second part of the question was, Rajvi, sorry.
It was, brain fog and joint pains, and will it just pass? Will it just go? I mean, I guess it will. Shishma Ben also.
Again, it's there's no definite kind of time frame for this, and just like hot flushes, you never know when it's going to stop. It does. Make sure that you're having a healthy, nutritious diet, your vitamin B12 and folate levels, especially if you're a vegetarian or vegan. make sure your vitamin B12 and folate levels are optimum, because all these things do matter.
Okay, and Shushma Ben, did you have anything to add to that?
Yes, so the first one about the joint pains. Quite common symptoms, and you may have specific issues. For example, suddenly you have a flare of something we know as plantar fasciitis, that, you know, whilst you are going through the perimenopausal period, you may develop heel pain, and which is quite severe, and joint pains anywhere else in the body as well. But these are transient times, so as long as you address that particular problem, maybe take some physiotherapy help, maybe start doing some gentle stretches, and have treatment for that symptom. Focus on yourself, maybe spend a little more time with yourself doing simple yoga postures, simple stretches. That will make a huge difference in those symptoms, and try to break that cycle, which is what Anuja said, you know, so you have pains, you can't exercise, and you can't exercise, so you have more pain. So we need to, maybe if you need to for a short term, take some help, conventional medical help, taking some anti-inflammatory or pain relief, and then break the cycle by, you know, treating that cause, and then move on with the exercise further.
Okay, thank you.
Thank you. Rajvi, I have a question I think it would be great if you could answer. As women will be working longer, how can they approach their employers if their symptoms are severe or moderately severe?
Thanks, Reshma. So depending on your employer, as you mentioned in your talk, Reshma, it is in law now that basically employers have to think of menopause as something that they have to deal with as part of their well-being of their employees. So one of the things is you should go to your HR department and ask them, do you have a menopause policy? And look up what is in that policy. And within that policy, there should be things laid out, the sort of things that they will accommodate, so requests for. So it might be being able to get your manager on training, or sitting down with an HR professional and saying the sort of things that you're going through, whether you need extra time off, whether you need to change where your office is, whether you need changes to your working pattern. And also some employers also offer occupational health, mental health services, and you may be able to gain access to those. But it is a conversation that women need to be happening. We are, 50% of the workforce. We're going through something that is not our fault, and we don't know how long it will be going for. And it is going to affect our performance and our well-being if the employers aren't on our side. So please go to your HR department, go to your employers, talk to your managers. And that is the way that we get a little bit of change going on. That would be my recommendation. Okay, there was a question somewhere, which I can't find at the moment. So I thought something that did occur to me. I'm going to ask Komal, why has the age of the menopause come earlier when women are living longer?
Yeah, I'm not actually sure about this answer, actually. I don't know if Anuja has any thoughts or knows about this.
Yeah, so I don't think we know for sure, but one of the theory is that little girls are actually starting their periods earlier because of good nutrition and because their bodies are developing earlier. Now, we are born with a finite number of eggs in our ovaries. We don't have limitless eggs. So once all these eggs are used up, we reach the menopause. So if we start early, we start having our periods early, where we have our menopause early.
Great, I think, yeah, that makes a lot of sense. Thank you.
There's a couple of short questions which I'll take. What kind of CBT do you recommend? So CBT is cognitive behavior therapy, and I believe Anuja and Sushma Ben also mentioned those, and they are really helpful. It's not counseling, it's not psychotherapy of any sort, but what it does do, it changes the way you handle issues in your everyday life. And CBT can really help with menopause symptoms. As we've discussed, we can have brain fog, we can have exhaustion, our perspective changes from glass always half full to always half empty. And CBT can really help manage those things. It can give you coping mechanisms that you can refer back to. And the other question was just around why do we need to do weights or weight-bearing exercises, which everybody has touched on. And weight-bearing exercises are really important, from what Sushma Ben mentioned about balancing out our energies, but also from joints in terms of making them more flexible, more reliable for us. We're running around doing lots of things, and it just means that we're not getting injuries more often. It will help control our blood pressure. It will just help us feel more energetic in many ways. And it's not something you need to start. We don't need to aim for looking like Arnold Schwarzenegger, but starting small will really help. Just doing what you can manage, even, a tin of tomatoes from the kitchen will really make a big difference.
Can I just add to that, Reshma, to say weight bearing as opposed to non-weight bearing exercises? For example, swimming is great exercise, but not necessarily beneficial for bone health that we are talking about here with menopause. So when you're weight bearing, it actually is a stimulus on your bone, So even for the upper limbs, even if you have small like baked bean cans or anything like that, an exercise that would make a huge difference to the bone health. So weight bearing, walking, jogging, running, that kind of activity is always going to be a great stimulant for continuous bone growth and deposition of calcium in our bones.
I'll just take a few seconds just to kind of elaborate a little bit more on that. So weight bearing means causing impact, and it's almost like causing little bits of injury to the bone. And when the bone heals, it heals stronger. So that's what it does. The more you kind of put stress on the bones, the bone heals and gets much stronger.
Great. Thank you. I have a question for Komal, if that's okay. I'm 42. The GP has done hormonal blood tests, which have come back normal. Can I still insist on HRT? Because I'm not sleeping, waking up at 3 a.m. every day, and very low mood.
So actually, yes, you can, because if you've had all your blood tests and everything's coming back normal, then it may well be actually you are starting the process and you're in the perimenopause. So actually it is worth going back to your GP and actually saying, well, actually, I would like to consider HRT, and they can talk to you about the options available to you since you haven't actually stopped having periods. So that is something I would encourage you to go back to your GP and have that conversation.
Thank you, Komal. I've got a question here, and I'm not sure if it's something we can answer here, but it's about surgical menopause. So someone's asked that they've had a surgical menopause and they are not absorbing any estrogen, and they're struggling. Any tips appreciated? What would be your advice to that person?
So for that specific question, I think as a professional, I would be actually saying you need to go back to your GP, and actually it may be that you need to actually be seen in a specialist clinic, such as a hormone replacement therapy clinic that's often run by gynecologists, and they might be able to give you further advice and support through their clinic.
Okay.
I'll just add a couple more lines to that. So that's absolutely the advice I would give. Unfortunately, with surgical menopause, your body has gone through the menopause very suddenly, and people who go through a surgical menopause, and particularly if you're younger, you need very high levels of estrogen, and sometimes even higher than the licensed dose of estrogen. So, for example, if the licensed dose is, say, 4 pumps of the gel, some women need up to 10 pumps, So the dose of estrogen is not actually dependent on any blood test. It's actually dependent on your symptoms. So you may just need more estrogen, but I think it's something that you need to speak to a specialist.
Okay, and someone else, it's to do with waiting for surgery. So I'm a 62-year-old. I've been prescribed patches to treat menopause, but I haven't started them yet because I'm waiting for day surgery, and the leaflet says not to take the patch for 4 to 6 weeks before surgery, but waiting lists are long and this person is suffering. So she's just wondering what to do. Should she wait? Should she take it? What should she do?
I would say is definitely, they would let you know if your surgery is coming within 4 to 6 weeks. So I think it's worth getting your GP to write to them and asking, roughly when the surgery would be, because you shouldn't be suffering.
Yeah, okay. Got another question here. What is the difference between progesterone and progestogen? And this person was saying that she is under the understanding that progestogen can aggravate people with histamine intolerance. I'm not sure if you can confirm that or not.
And shall I go?
Yeah.
So progestogen is an umbrella term, and progesterone is what we produce in our body. So progesterone is part of the progestogen family. Does that make sense?
Right. Okay. Thank you.
Anuj, I have an interesting question for you. So you mentioned the estrogen is derived from the plant yam. Will eating more yam help?
You're needing to eat a lot of yam every day. Yeah, no, you'd only be eating yam all day, every day if you wanted enough. Yeah, it's not possible.
Okay.
Thank you.
Are there any foods that would support our hormonal fluctuations? Obviously vegetarian. Shushma Ben, do you have any suggestions?
Yes, so I mean, I mentioned that in the presentation earlier. So foods which, again, very individual from Ayurvedic perspective, depending on your constitution and your body type. But generally, if you are suffering from symptoms of pitta, which is hot flushes and excessive heat in the body, then you have cooling foods, cooling teas that we talked about. If there is a lot of brain fog and lack of concentration, and you feel muscle loss and weakness, so which signifies high vata in our body, then you want to avoid actually cold food, cold in the sense try raw food, but have hot, freshly cooked meals, and certain vegetables, for example, broccoli or cauliflower family, would aggravate vata. I wouldn't generalize this, as I said, I keep saying that over and over again because it depends on the individual, but certain vata aggravating foods could be avoided, and foods cooked in sesame or coconut oils, and avoid raw salads, but have a saute salad, for example. Those kind of things would be useful.
Okay, thank you.
I have a question around blood pressure and HRT for Komal, if that's okay, please. Are you not allowed to be on HRT if your blood pressure is on the higher side, or can HRT actually help to lower it?
So actually having extremely raised blood pressure would probably be a contraindication to being on HRT. However, if you have got high blood pressure and that's being quite well managed with medications, then actually there's no reason for you not to be able to be on HRT. Sorry, what was the second part of the question?
Yeah, can HRT help lower the blood pressure?
So actually, I'm not sure about the actual evidence, but what I would be saying is actually, if you're suffering with symptoms such as anxiety or just feeling quite basically anxious, worried, your symptoms of night sweats are just really causing you a lot of stress, that in itself could actually elevate your blood pressure, because we know stress is a factor that can affect your blood pressure. So actually, if you're going to be on HRT and that actually helps to relieve or ease your symptoms, that may well inadvertently actually just lower your blood pressure.
Okay, great. Thank you. I'm going to just, I think we're going to be coming to in shortly the last question, but before I do, I just also want to do a big shout out to our tech team. Can you all just come on screen if you're able to? So people who are helping and answering questions and making sure you can all hear us on YouTube and Zoom, Kilit Bhai, Mehul Bhai, as well, Ajay, and I think I'm missing someone out. I can't remember who it is now. I did say the name earlier on. I'll just check here. If they can come on screen and we can just say, Ketan Bhai, there we are. Thank you so much for your help. So we're going to say our last question. Thank you so much for our speakers. And remember, you can watch all of this on YouTube as well. Do tell, and also for any of you listening, if you've got your husbands and partners, please get them to watch this video too. They need to watch it too. So last question. Let's see, there was one there. Can prolonged periods, more than 2 weeks, be a sign of the menopause?
Okay, I'm happy to take that. So when you're going through the change and you're going through perimenopause, it's really important actually to understand that your hormones, yes, they are overall, your progesterone and the estrogen are falling, but they do actually fluctuate during that time as the general decline in hormones. So what that can do to your periods, one, it can make them irregular. And for some people, that can mean your cycle lengths get prolonged or they become less. Some women may experience heavier periods, and for other women, they can become a lot lighter. And even the duration of your periods may well change as you approach the menopause. So actually, that could be quite normal. If it's something that's concerning you, then I would actually suggest going to your GP to have that investigated further if you feel it's necessary, because we know that there are other gynecological conditions that may also cause this to happen as well.
Right, so it may not be the menopause in it, so it should be checked out. Okay, I think we're going to wrap this up now. I think thank you very much again to our speakers, to our tech team, and most of all to all of you who have logged in and joined us on Zoom and on YouTube. Please watch out for the new messaging and the new flyers in the new year when our next webinars will be posted out to you, and I hope to see you all then. Thank you, everyone. Good night, and we'll see you again soon. Jai Jinendra.